Now, for the two main groups of patients, the denture wearer or the person that's been determined all their teeth have to come out, can't save them, and they don't want a denture, what are the steps to getting their new teeth with dental implants?
Yep, great question. So first step is a patient comes in and they sit down with us. We take a 3D scan, we sit down with them, and we go over their options. There's always options, and so we want to make sure the patient's aware of what those are. When we decide kind of as a team what is the best option for them and what they want to move forward with, the next step is the smile design. And this is a fun step. This is when a patient gets to sit down with our specialist, with our prosthodontist, and they get to design their smile. They get to plan what they want their smile to look like. And there's some patients that need just a top, just a bottom. Maybe we're going to save most of their teeth, and that's the step where we decide, what the plan is.
Okay.
Third step is the procedure. In one procedure in one morning, we let them go to sleep with our anesthesia team. They're comfortable. We take care of the whole procedure. They wake up and everything's done.
And they have a new set of teeth.
They have a new set of teeth. Fourth step, kind of the unofficial step, is they get to go out and they get to start enjoying life. They get to eat and drink things without pain and sensitivity. They get to travel. They get to start dating again. And that tends to be the most expensive step. But those are the three steps to getting this done.
Now, you'd have to have an opening in your schedule, but literally they meet you, you go over options, you design their smile, and they get their new teeth. Could it be done in 3 different days? Like all in 3 visits?
That's exactly right.
You ever done it in 2 visits?
We've had patients that have traveled from out of state, out of the country, and we can even shorten that to a smaller amount of time. We just need to know what they want these teeth to look like. We need to gather a few records with our 3-dimensional scan, and then the procedure. And that's one morning. They go home by lunchtime.
Now, one of the reasons, and correct me if I'm wrong, that you are able to do it so quickly is you have smile designers right there. Is that correct?
And
that's unusual.
That's correct.
Right?
That's correct. And not just the equipment, as you started to mention, the full team. We have the specialist, the surgeon, the prosthodontist, the anesthesia team, the assistants, and very important, the technology that you mentioned, all there in one location. Patient comes in, gets it all done in the morning, and they go home with a set of teeth that afternoon.
Now, is this true? The denture wearer, on the day of the procedure, they can walk in with no teeth, and that day walk out with upper and lower teeth that don't come out?
That don't come out. That's exactly right. Most denture wearers come in with their dentures in a Ziploc bag because they don't like wearing them anyways. And we get to send them home either with those dentures in the trash or send them back home in the Ziploc bag. This is a procedure that they go home with a permanent set of teeth that don't come out.
Correct me if I'm wrong. The way dental implants are typically done throughout the U.S. is you go to one doctor's office where they do they put in the implants. Another office, they put the teeth on top. In another office, maintain them. You do all 3 parts.
That's exactly right? We've combined all of those steps and all of those specialists into one location. And that's exactly right. Because of that, and because of a patient having to go between multiple locations, there's things that can be lost in communication. There's extra time, extra chair time that's needed.
Did you used to do it that way?
I did.
You can't go back to
many years ago.
Way?
It would be so painful to go back to that way. This is such a more accurate, more efficient way that just constantly leads to better results.
Do you have oral surgeon buddies that are doing it that way, where they have to send it back and forth?
I do. I have colleagues that are still doing that way. They don't know what they're missing out on. I recently had a family friend that had come to me and said, I'm getting this procedure done. I have my dentist who referred me to a surgeon who referred me to a periodontist. He was getting 3 different procedures done in 3 different locations. The plan was for this to take over a year, was going to cost double what it should have because each specialist is charging their premium. I said, come down, we'll take care of you. One location, one day, we were able to do what was going to take him a year between 3 doctors otherwise.
So that goes on. Does that frustrate you that that's going on?
It does.
And it's a message you obviously want to get out there.
Exactly right. Knowing that there's a better solution for these patients that's going to ultimately save them a lot of time and money, everyone needs to know about it. It's the way that it should be done. And if I had a family member, that's the only way that it would be done for them.